I would like to start off by having a show of hands to anyone who has been hospitalized or known someone who's been hospitalized or been to the doctor before. Okay, you may put your hands down. It is safe to say that some of us know or are healthcare consumers. As a healthcare consumer myself, it is important to know how our electronic health information is communicated amongst our providers and how technology plays a role in our healthcare today. Since developing electronic health records, or EHRs, they have assisted providers in giving care to their patients. So to those of you who raised their hands earlier, during your time of care, you probably had an EHR created for you or some type of component to the EHR was made at that time. I've taken a keen interest to the healthcare world ever since the first time I can remember I went to the doctor, which probably led me to be a health information and informatics management major here at Tech. Today, I get the pleasure of informing you guys on what exactly an EHR is, the benefits, and some of the drawbacks that it has when it comes to healthcare and information management. I would like to get started by first officially defining the term electronic health record. According to an article, Electronic Health Records, What Are the Most Important Barriers, published on the AHIMA website by Dr. Noder Murani, it can be defined as an information system that helps collect individuals' health information from birth to death so it can be registered, certified, and shared in different places by healthcare providers. So this collection of information starts at the very moment that you check into the hospital or you check into to your doctor's office. Whenever you see him typing into his tablet or computer or referring to your history and physical or getting results or lab results from previous times, he's using your electronic health record right then. Okay, since we have a better understanding of what an electronic health record is, let's talk about why it's so beneficial to providers and patients today. So to highlight some of those benefits, that it provides up-to-date access to clinical information. It helps by avoiding inaccurate documentation of the services that were provided to you that day. It allows your provider to spend more time at your patient bedside. So this will result in a better diagnosis result. And all of this is securely shared onto the EHR amongst other clinicians and, of course, you yourself. The EHR does all of this with some special functionalities. Some of these functionalities are clinical decision support tools. These are the tools that the doctor uses to help come to a conclusion of your diagnosis. Another one would be computer physician order entry, and this is what helps the misdocumentation of providers documenting your care. This helps provide a template for them so it makes it easier and quicker for them to do so. And lastly, health information exchange software, which provides a secure site for your information to be protected. So as with everything that comes good, there are some drawbacks to an EHR. Cost is one of the highest drawbacks when it comes to implementing and adopting a new electronic health record. According to the article, Benefits and Drawbacks of Electronic Health Records Systems by Taylor Collum, she highlights some of these issues to be mainly financial. This is including adoption and implementation cost of the EHR, purchasing and actually installing that software into the system, converting all of the old paper records into electronic health records and the personnel that is needed in order to do that. And of course, training your entire staff on how to use this entirely new system that is meant to help patient care. So in order to conclude my spiel on electronic health records, I hope you guys can take away a better understanding of what an electronic health record is, some of the benefits and the drawbacks of it. Next time you're at your doctor's office, I encourage you to ask questions about your EHR and how it plays a proactive role in the quality of your care. Thanks.